Hi, I'm Dr. Vicki Peterson. I'm often asked about hiatal hernia syndrome and how did we discover it and how did it turn into a book and now it's an online course and how did it all begin, and it actually goes back over 30 years, and I'm going to hopefully do the adventure justice in under 30 minutes. But yeah, how did it all begin, and who is patient one, and how did the evolution and discovery of how all these parts intermesh, and the structural aspect of it and the internal aspect of it, and then discovering the drugs that are given that have such dangerous side effects, and what do you do instead? And then all of a sudden, 2010-ish, surgery centers were cropping up everywhere, when before that doctors weren't even mentioning hiatal hernias that they found on endoscopy. And then what happened when 2020 hit, and what did we do then? And then the book, and where are we now? What's the latest evolution of hiatal hernia syndrome? So let's jump in and review all those things. So I can start with patient one, and patient one was 30 plus years ago, and she was a young woman who was a new patient for me, and we had just kind of gotten started with one another. And she came in one Monday morning and she's like, I had a horrific weekend. And I'm like, what happened? So she said, I awoke Saturday night, and in the middle of the night, and I couldn't breathe, and my heart was pounding out of my chest, and I just thought I was dying. I didn't know what was going on. And she's just like, I couldn't breathe, and my heart was pounding, and it must have been, she was thinking it's got to be a heart attack. So she got to the ER. She was a single woman on her own, so got to the ER, and they ran blood, and of course did an EKG on her heart, etc. And she said they could find absolutely nothing wrong with me, other than they diagnosed me as having a panic attack. I was like, oh, so is that something you've had before? She goes, no. They said, manage your stress, and here's an antidepressant. And so her story was that she had never had any issues with anxiety. She wasn't an anxious person. She didn't have a highly stressful life. And this was just out of left field for her. And of course now she was anxious because she didn't know when was the next time this was going to occur, right? So it was just an awful, terrifying experience. So that day I found her diaphragm to be in spasm quite a bit, so we worked on that. And she had come to see me because she had chronic constipation and bloating. So her health history, as far as I was concerned, all had to do with her gut and digestive distress, and it had been chronic for her. This is not something that happened the week before, even though she was young and in her early 30s. So she had this chronic digestive upset, and we went to work on that, and she did very well, and she never again had one of these panic attacks. But root cause medicine, which is what we do here, means just that. The way we think is why? It's asking that question of why is somebody's body doing what it's doing, and that's a very different conversation than traditional medicine, which just says, okay, this person does not have heart disease, does not have lung disease, we couldn't find anything on her blood tests, she's clearly panicked, so therefore give her a drug to handle her panic or her anxiety. And we don't work that way, because sometimes you do need to band-aid a symptom. Let's get real. If you're having, if you have high blood pressure, you can't be silly about it. You've got to come in there with a medication and get that blood pressure lowered so that you don't have a heart attack or a stroke or something like that. But we are a medical clinic, so we can prescribe medication. Usually people are already on the medication by the time we see them. But in this example of high blood pressure, if somebody comes in on high blood pressure, has high blood pressure, is on a medication, we want to know why. What's driving that blood pressure to be elevated? If you're on a med to keep it stable, totally fine. But let's figure out why, you see, and the why is different for different people. So getting back to patient 1, as I said, we've resolved her digestive problems. She never again had another panic attack, but it planted that seed of, wow, how is it related? You know, I certainly found her diaphragm in spasm. Was that just a result of the bad experience at the hospital? You know, what was the relationship? So as the years passed, we saw more patients having this issue with sort of diaphragm spasm, and that sort of the elevation that happens with the diaphragm when it is in spasm, and seeing the connection with acid reflux, chronic constipation, or IBS. People have irritable bowel syndrome, so that could be constipation, diarrhea. So we definitely started seeing this, you know, chronic gut issues, and maybe that having a connection. With these chronic gut issues, of course, everybody was coming in on an antacid and most often a PPI, a proton pump inhibitor. So this was handling, for most people, the symptomatic problem of acid reflux, because if you've had that, and you've had that burning in your chest, you've had the heartburn, sometimes you're tasting acid, sometimes you're spitting out acid. It can get very dramatic when it's really being aggravated. And so again, from a root cause approach, we didn't like the fact that people were just left on antacids. Because, why? We know very well that the stomach is supposed to be a bag of acid for a very good reason. It's its job to make acid, because that's the first place food goes. You know, you chew a bit. None of us chew as much as we should, but then you swallow, and the food goes down the esophagus, and where does it land? It lands in your stomach. And that stomach is designed to be a bag of acid that churns that food around and breaks it down so that it's of a proper broken down level. You know, this is early digestion, so that it can then be secreted into your small intestine, where the majority of digestion and absorption takes place. But if you've diminished that, what we knew to be true even back then is if you're diminishing the amount of acid in the stomach, you're going to set yourself up for poor digestion and absorption all the way down the rest of the digestive tract. So just managing or masking this acid reflux with sort of making the stomach wrong, if you will. You know, when you put somebody on an antacid, you're basically saying your stomach's making too much acid. And that's not the case. It's not that the stomach is making too much acid. It's the fact that the stomach is being irritated enough, compressed, it's a bag, compressed enough that that acid has to shoot up the esophagus, and now you have a miserable experience. So we were always trying to figure out, okay, why? You know, why is this stomach being compressed? What's that pressure coming from? And so we were looking mostly in the gut, and that absolutely is an answer. So, you know, definitely the ability of Americans to be eating a good diet and having a healthy digestive tract, that was getting worse over the years. And we saw it. We absolutely saw it more and more. And so because people were so miserable with their acid reflux, they were going to gastroenterologists, they were being given the PPI prescriptions, but they were also getting endoscopies, you know, so they had the scope, you know, going down their esophagus, and seeing how much irritation or damage had occurred due to the acid, and that was commented upon. It's like, oh yeah, you have evidence of acid reflux, or you've had this for quite some time, you've got maybe an esophageal ulcer, or you have some strictures, some narrowing of the esophagus due to all this acid. So patients were hearing about that as a result of their endoscopy, or maybe having an infection found in their stomach, which is called Helicobacter pylori. So those results were coming, but what wasn't happening is there didn't tend to be any mention of a hiatal hernia. And very often we'd say to patients, oh, well, did the doctor mention a hiatal hernia? And it was like, no, that wasn't mentioned. They just said, I had reflux, and here's your PPI, and I needed to take this because that's where my inflammation was coming from. That's why I was so uncomfortable, etc. So I was like, okay. But then what would happen is patients would go back on their own. We sort of planted the seed, and this got them curious. And so then we'd hear from the patient, and they'd say, I went back on my report, and I have a small hiatal hernia, but the doctor never said anything about it. So I was like, oh, that's interesting. So then, as time passed, we would tell patients, if they didn't mention that the endoscopy showed it, we'd say, get the report for yourself and read through it and see. And sure enough, we started hearing more and more. It's like, no, it was there, but the doctor didn't mention it. So back then, this is now pre-2010. Is that right? 2010? Yes. So, because actually in 1991, the surgery first got the laparoscopic surgery, where they fold the stomach and tighten the areas where the hiatal hernia is. That actually, the surgery developed in 1991, but it wasn't until about 2010 that surgery centers started popping up, and they were popping up a lot. So prior to 2010, we had no mention of a hiatal hernia, and the patient would find it on their own. But then, just post 2010, what occurred was now patients were talking about it. It's like, oh, my gastroenterologist found a small hiatal hernia, and they're recommending surgery. And it's like, okay, let's look into this surgery thing. And again, this surgery was fairly new. They first created it in 1991, so it had been out for a little bit, but all of a sudden these surgery centers started popping up all over the place. And so of course it took some time to say, how successful is this? But what didn't make sense about it is that what's happening with the hiatal hernia is the stomach is getting compressed from outside forces. So this is inflammation and imbalance in your gut, and it's getting compressed, and then it's getting pushed up. Because remember, your stomach is connected to your mouth via the tube, the esophagus. So as the stomach gets compressed, it's gonna have to get pulled upwards, you see. And so and then as it gets pushed up more and more, it starts to go through, instead of the narrow opening that the esophagus passes through, now the wider part of the stomach, from pushing is spreading that opening. That's what a hiatal hernia is. And so a hiatus is just an opening or a hole, and a hernia is something protruding through a hole that shouldn't be. So in other words, the upper part of your stomach should not be protruding above your diaphragm. The esophagus passes through the diaphragm through that hole, that opening, and then the stomach sits comfortably below the diaphragm, not pushing up through, which is what the hiatal hernia is. So what they were doing simply in this surgery is kind of sewing everything back together, and they would actually alter anatomy, which is another thing that didn't set great with me and my team. So they were altering your stomach anatomy and then sewing everything tighter so that it wasn't expanded. But from a root cause approach, what's wrong with that? You get a hole. Let's say you get a hole in your jeans because you constantly are, on your knees on a part of the floor that has sandpaper. It's not the best example in the world, but. So, somebody could sew the jeans closed, but then you keep doing this activity, right? You keep, being on your knees on this area of the floor that's rough and ragged, and it's tearing open again. So similar with hiatal hernia, there's the pressure. You see, there's that pressure on the stomach that's forcing it to come up. And so instead of just, sewing it tighter, why don't you go, well, why is the stomach being pressured and being forced to push up? What's the source of that, right? Of that pressure? And so that's what we did and do set out to answer, is what's the cause of that? Because when everything relaxes back to the position it should be in, then what happens? The body heals. The body loves to heal, and it knows how to heal. It's a very sophisticated healer and repairer, which is what's so incredibly wonderful about working with the human body. As time has passed, we've learned the surgery does not have very good long-term results. In fact, it can worsen the symptoms people come in with, or they get relief for a while, but it comes back. So of course it comes back, because nobody's getting to the root cause of where the pressure's coming from. So then pressure's happening again, and then it's getting spread open again, and not to mention you're altering your anatomy, which is a little scary, because we have a beautiful, pretty perfect machine as it is. So the next piece of things came when we had a physical therapist, a doctor of physical therapy working with us, and she, we worked as a chiropractic clinic, physical therapy clinic. We had the internal medicine side of things. And so as she was working with us, she was very fascinated with the hiatal hernia, and as she learned more about it, she started just checking more and more patients for this, and she termed it a high diaphragm. So we always kind of talked about it from our training as sort of a spasmed stomach, but her terminology was a high diaphragm. She's like, I keep finding all these high diaphragms, and she goes, it's really, really common. And so again, it happened because the diaphragm is right above the stomach, and as the stomach compresses and pushes up, it elevates the diaphragm, hence the high diaphragm. And also due to the pressure of the stomach on the diaphragm kind of spasms. So it's elevated, but it's also spasmed, and that leads to shortness of breath, potentially, as well as anxiety, because that piece of the puzzle comes from the fact that your nervous system is very attuned to how much air you're getting, how much oxygen you're getting. And when the diaphragm spasms like that, it's not floating the way it should, and it's more just moving less freely. And your nervous system notes that, and it sends out stress hormones to say, not enough air, not enough air, not enough air, this could be life-threatening. And it really is a protective response. But when you're feeling this sudden anxiety that comes upon you when the environment, it doesn't make sense that you should be feeling anxious, because you look around you and you go, everything's fine, why am I feeling anxious? But it kind of wafts over people, and then they're short of breath and they're anxious and they don't know what to do, and they want to crawl out of their skin, and they think they're going crazy, but it's all happening internally. So if there was like a way to pick up the phone, say, body, what are you doing and why? It would have such a beautiful explanation. You'd go, oh, that makes sense. Thank you very much for the warning of not enough oxygen, you see. So we started to work on that, and then again, the doctor of physical therapy, she got fascinated with this, and she was really delving into the diaphragm. And she's like, we of course knew to work with somebody's neck, because the nerve that goes to the diaphragm comes from the base of the neck. So we'd been doing that already. But then she was really getting involved in the middle back and how the ribs were moving, because the diaphragm is covering like the bottom five or six ribs of your 12 rib cage, and it's quite fascinating. The diaphragm is this dome. It's huge. And there's blood vessels that pass through it, and the esophagus passes through it, and just started to appreciate really a part of the body that to this day is pretty ignored, other than like in yoga where you do, really focus on breathing. Nobody pays much attention at all to the diaphragm, and it's an integral part of hiatal hernia syndrome to create shortness of breath and to create the anxiety or the panic attacks. So it was really an important component. So we started to appreciate more of that. Then we realized, even over and above that, that there are ligaments going from the diaphragm to a major hip flexor muscle called your psoas muscle. That starts with a P, so it's PSOAS. And that people could have chronic hip problems that were offsetting their diaphragm, or somebody could have scoliosis of their spine offsetting their diaphragm, or someone could have had a whiplash injury irritating the nerve going to the diaphragm. So it opened up a whole structural aspect of what we now call hiatal hernia syndrome, that if somebody's just coming in with acid reflux, they're not thinking about their tight hip, or some people don't even know that they, just breathe with their shoulders, and they can't belly breathe and really get air deep into their lungs because their diaphragm's been spasmed for so long. So it just became pretty fascinating as this world was opening up, and all these factors were, a part of it over and above the gut, which still is, the main aspect of it. And that was something we knew from day one because we were focusing on it. And then the next evolution structurally was understanding the vagus nerve. So this is the longest cranial nerve you have, so it starts in your skull. But from school, of course, we knew the vagus nerve kind of goes everywhere, very much to the gut, to the heart, but weren't thinking about a cranial nerve connection. But it turns out that at the base of the esophagus, the vagus nerve is like a web around the base of the esophagus, so that as that poor little stomach gets compressed and pushes up, it's irritating the vagus nerve at the base of the esophagus. And so now you have symptoms of, common symptoms of associated with acid reflux, like bloating or nausea. But then in addition to that, you can have trouble swallowing, or you can have loss of gag reflex. You can have dizziness or lightheadedness. The vagus nerve started tying into the heart association, where you're having your heart rate go too high or too low, your blood pressure is altering. What else on my vagus nerve? Fainting, nausea, vomiting, bloat. So you had the classic digestive symptoms, but then you had mood swings, and you had the fainting, and you had the issues with swallowing, or hoarseness. Like, what does hoarseness have to do with it? But you'd have patients who really didn't have classic acid reflux, but they had these symptoms. Then we learned about silent reflux, that actually 50% of acid reflux is silent, meaning you're not getting that classic heartburn, burning in your chest, or the spitting up of acid. Instead, it's called silent because the acid is just kind of slowly trickling up the esophagus, and then it tends to kind of terminate its journey up in here, and that's when you're getting hoarseness and a cough, and you feel like something's stuck in your throat, or you have trouble swallowing, and people are regurgitating food, and they're trying to swallow a vitamin and it doesn't go down, or we're terrible at chewing. They have a hunk of meat and you only gave it a few chews, and all of a sudden it gets stuck, and that's a horrible feeling, because your esophagus can really spasm, and then you really feel like you're having a heart attack. So these symptoms started to tie together. It's like, wow, another layer opened up, and appreciating that we needed to rebalance the vagus nerve, because your vagus nerve had another aspect to it. I mentioned just mood swings, but also anxiety, because your vagus nerve is is the nerve that kind of shifts you into what's called your parasympathetic nervous system, which is your rest, digest, and relax, you see, versus your sympathetic nervous system, which you've heard about. That's the fight or flight part of your nervous system. So when that diaphragm spasms, you can get into fight or flight because your body's trying to make sure you know there's not enough oxygen here, and I need you to get excited about this, and I need you to do something about this, you know, and it's trying to protect you. But not only that, the diaphragm being spasmed, but the vagus being irritated is going to sort of make it not be able to work as well, and now you're in sympathetic overdrive because of that as well, because that balance of the rest, digest, and the fight or flight, it's not happening because the vagus is so irritated. You're more into this sympathetic fight or flight, you see. And so I had a lot of patients come in with a lot of anxiety and a lot of mood swings, and of course their gut was a mess, and we know the gut-brain connection, and of course we do work with hormones, and so we saw all that, but we didn't, you know, appreciate how the diaphragm and the vagus nerve was really what was influencing them. So, as I said, that sort of opened up a whole another world. So then the next level actually came 2020, that beautiful moment of time that none of us will ever forget. And at that point, our clinic was in California. We were building the clinic we're here with now in Florida. And things, of course, shut down. And our doctor of physical therapy at the time, we didn't have too much issues with telemedicine because we were already doing telemedicine. So the internal medicine part of working with hiatal hernia, from working with the gut and hormones and everything that was not physical, could carry on pretty readily because we were already doing that. But on the physical side of things, all of a sudden patients that were coming in to get treated, working on their diaphragm, working on abdominal exercises, working on breathing exercises, just a variety of things that come up with this syndrome, all of a sudden they were gone. We weren't seeing them. And my doctor of physical therapy, she said, I want to figure out a telemedicine treatment for hiatal hernia. I'm like, with what you do? And she's like, yeah. Well, okay, that should be interesting, you know, go get them. And she did. And so what she did was visits over Zoom, and where she would evaluate new patients, she would continue her treatment of her current patients, and she figured out how to do it. And so sometimes, you know, people go, well, if they can't touch you, how is it possibly happening? And I would liken it to, you know, seeing a neurologist who's doing certain like orthopedic and neurologic tests. You know, you can see a doctor like an orthopedist or a neurologist, and they'll say, okay, you know, tilt your head to the side, and now you know, bring your arm straight out to the side, and when you tilt your head this way, what do you feel? What do you do? And so they're telling you to do things, and you're reporting what your body feels. You see? So did that aggravate your pain? Was that not painful at all? Did you get any tingling or numbness? So there are definitely tests one can perform by watching someone and having them tell you what they're experiencing. So it was pretty brilliant. And you know, she would be on her, you know, yoga mat on the floor, and then the patient would be on theirs, and sometimes she'd get really close to the screen and just say, okay, so I'm not seeing the breathing through your ribs. Put your hands on your rib cage. And then of course the hands wouldn't move because they were breathing all up here. And then, you know, she would talk them through it, and then all of a sudden, you know, you could see their hands move. It's just like, that's it, that what you did just there. And so it was this beautiful evolution of being able to help people that opened up a whole new world. So we can thank 2020 for that. But the other thing that happened was that she laughed about is that she would always tell patients, you need to do these, you know, she called them maneuvers. So we call them maneuvers, and then as you get better, then there's exercises. But you start with basic maneuvers. And she would want people to do them twice a day. and it was like 5 or 10 minutes twice a day. It wasn't asking a lot, but I would hear her over and over again, pre-2020, patients in the clinic, she's like, you're not doing your maneuvers. I can tell you're not doing them. And the person would go, yeah, but then they could come in twice a week, and she would sort of work them over. So she said, one thing that's great about this is that I'm working with patients and I'm telling them to do these twice a day, and they are, because they don't have me as a crutch to do it for them. So that was a nice evolution, as well, as people were actually getting better faster via the telemedicine that we were forced into on the physical side of things. And as I said, for the internal medicine, it wasn't a problem because we had been doing that for quite some time. Also, 2021, the team started really contemplating sort of the epidemic nature of this issue, and just finding all ages, men, women, suffering from this, and suffering in such a devastating fashion. And so anyway, it was, okay, we need to write a book, which was code for me to write a book. And I was like, oh gosh, I was already having my moment at 2021, because in California things were very shut down, et cetera, et cetera. We won't relive that nightmare. But yeah, it was a tough time, and we were also building a brand new clinic across the country in Florida. So there's a lot going on, and decided to write a book. So did that. So that was great. And it was a few years later, having sort of survived all of that, my YouTube channel had actually been going on for quite some time. And when we first realized how important this was to share with people and how many people were likely suffering, what we did was, my staff was like, you just need to do videos on hiatal hernia. And I'm like, how is anybody going to find a video on a problem they don't know they have? Who's looking for hiatal hernia? People have never even heard of hiatal hernia. And so I was like, well, what I could do is, do you have acid reflux and also heart palpitations? Or, are you suffering with acid reflux and you have anxiety? So I started sort of pairing the symptoms together, because people knew their symptoms, right? They certainly knew if they had acid reflux, and they knew if they had heart palpitations or they had shortness of breath, and started like pairing these together, and then started weaving in, this could be hiatal hernia. And that's how the channel took off, and more people became aware, which was great, because of course, as I mentioned, prior to 2010, people were getting endoscopies with their gastroenterologist, and even if they had a hiatal hernia, they weren't being told they did, unless it was huge and they needed surgery, which is when you do need surgery, in my opinion. So that was that. And then the latest evolution has been the fact that, due to my YouTube channel, hearing from people literally all over the globe, and some really, stories that would pull on your heartstrings for sure, of people just getting, they couldn't go to work because they had so much anxiety. And what would happen is they were afraid to get in their car because they'd had a panic attack one time in their car, and so now being in the car got them anxious, and all of a sudden their life just went from a beautiful, busy life with family and children and friends and job to this, I'm staying at home because I just get out of breath so fast, and I'm just so miserable. So with these stories, I realized that we needed to help more people and make it more accessible. So this past year, 2024, it's almost been a full year, but now it's been launched for a few months, is our online course, which is available to anyone, no matter where you live in the world, because it's a little more difficult to work with certain international countries than others, and also it's a price point that's more affordable for people. So we just tried to make it very, very affordable for individuals, and so that's sort of the latest evolution, if you will, of hiatal hernia syndrome, and everything we've learned and everything that we know is in that course. So everything we know to date about the subject is in that course, and then you get live sessions with a nutritionist as part of it. So that is the latest evolution, and that's pretty much the story of 30 years in, I didn't quite do it under 30 minutes, but about 30 minutes. I wanted to finish with a success story from a patient, and this is actually in the book. So we'll finish with that. And she said, I'm writing my story in the hope it will help others. A couple of years ago, I started developing uncomfortable symptoms after eating. I would have shortness of breath and chest pain and pressure. I got it checked out by my traditional medical doctor. He concluded it was just acid reflux. After taking acid reflux medication for a couple of months, things only got worse. I had more chest pain, could hardly eat anything without getting short of breath, and feeling very full and bloated. She said, yes, even a salad created these symptoms. After seeing no results, I got a second opinion from a gastroenterologist. They performed an upper endoscopy, told me I did not have any signs of acid reflux, but I did have a slight hiatal hernia. They told me this hernia was not causing any of my symptoms. Maybe some of you have heard that. They thought I had a sensitive nerve in my esophagus and was suffering from anxiety, so they described me antidepressants, an all too common story. I was very skeptical, she says, of taking these pills, as I never thought I was an anxious person at all, which I hear a lot of. After 3 to 4 months of taking these pills, I started to develop more symptoms, in addition to the original ones I had started with. She said now I had heart palpitations, dizziness, and numbness in my feet. All these symptoms occurred after eating meals. So one day I ate some fried food, and 30 minutes later I had severe shortness of breath, dizziness, chest pain, heart palpitations, and numbness in my limbs. I thought I was having a heart attack. I ended up going to the ER, and they did multiple tests. All the tests came back fine, and they said it was just a panic attack and gave me antidepressants, gave me different antidepressants to take because she had been on those. She goes, nothing got better, so I started Googling and researching and came across Root Cause Medical Clinic's website. She said all the symptoms they described on their website about hiatal hernia syndrome fit me to a T, so I decided to give them a call. She said my life changed forever. My health has improved tremendously under their care. They ran multiple tests, figured out I had an H. pylori infection. She defines this very nicely. She goes, a bacterial infection in the stomach. She had vitamin deficiencies and a gluten sensitivity. She said, I had looked into possible gluten intolerance before and tried to eliminate it from my diet, but did not know that you had to take certain steps to see real results from eliminating gluten or any other food. I got treated for the infection and vitamin deficiencies with supplements and probiotics. They were great at not giving too many supplements, as some other doctors tend to do. I only had to take 3. I was put on the elimination diet, as I mentioned before. After about 5 weeks, I noticed a tremendous difference. My symptoms started to slowly go away. I was able to do more activities again. I developed so much more energy, and my mood improved tremendously. I had no idea that gluten and vitamin deficiencies could be causing so much havoc on my body. My experience at Root Cause Medical Clinic has been amazing. All the doctors have been helpful, so helpful and knowledgeable. Unlike traditional doctors, they get to the very root of the issue and do whatever it takes to figure out what is really causing your symptoms instead of masking them with drugs. The registered dietitian was so incredibly knowledgeable and has an answer to every single question. She's a walking dictionary for nutrition. None of the doctors pushed a bunch of supplements on me, which I appreciated. I would 100% recommend Root Cause Medical Clinic to anyone that I meet. The doctors are way ahead of the game when it comes to medicine. I hope one day this sort of treatment is common in every doctor's office. And then she said, I want to spread the word of the great things that the clinic did so people suffering like I was can find great relief. The money spent and time spent for visits are so worth it. Your health is everything. This was Maggie B. So I thought I'd end on a little testimonial. There are so many testimonials on our site, so many Google reviews, and people are so wonderful in writing their stories in such great depth like Maggie did. So Now you're all caught up on the hiatal hernia syndrome story. If you don't suffer from these symptoms, I guarantee you somebody in your life does. And certainly the earlier you catch them, the better. But we've seen people who've been suffering for decades still do very, very well. So please share this video with others that you know who are suffering, or if it's yourself, we're more than happy to help you.